Do you have overlapping toes that do this, or your big toe and your second toe do this? I'm gonna tell you all the tips and tricks how to get rid of this at home, countdown fashion. We're starting now. So overlapping toes, that could refer to the big toe joint overlapping with the second toe. That's the most common. It could be on top, it could be underneath. You could have all the toes curling here. There's a lot of names this goes by. Hammer toes, bunions, overlapping toes where that second toe crosses. There's a lot of easy stuff you can do at home for sure to start getting these better. The important thing to know here is that you have a lot of tendons at the bottom. See these tendons right here? There's muscle layers, there's tendon layers. This is called your flexor digitorum longus. Most people don't realize this, but these tendons actually come above your ankle and they come from the bottom of your toes on the inside of your ankle. So if your ankle's flattening, your toes are gonna curl. If your knees are rotating in, your toes are gonna curl. So this happens quite a bit. This is usually why the toes curl, the big toes curl. So this poor little innocent toe, people are trying to do surgery on it, they're trying to do braces. I'm gonna tell you how well all this stuff works. We're gonna do a countdown fashion of the top 10 things I do in the office every day to start getting these things better. Number 10, make sure you have the proper diagnosis. The first thing is you do want to get an x-ray, because if the bone's broken, if it's dislocated, if there's severe arthritis, or there's a screw or a pin or something stuck in there, it might need some more work. I love to do an ultrasound because down here you can get capsulitis. That means inflammation of your capsule. You could get tendinitis, which is the tendons can be thick and inflamed. You could get a plantar plate tear. So there's actual cartilage layers underneath the knuckles of the joints that could rupture. There could be nerves that's swollen. You could have curled toes with arthritis. So we want to properly assess this. And I would say that's the number one mistake people are making. They're just not diagnosing it. But you can still try a lot of this great stuff at home. Number 9, shockwave and laser therapy. This is at the bottom because you can't do it at home, but I love shockwave therapy. This uses sound waves to break up thick scarred tissue. Almost right away, I've seen that tendon lengthen and that capsule lengthen. Laser therapy as well. It can warm up and loosen those joints, and it's safe. It's not surgery. I've seen this, especially for scar tissue. It can make it softer almost within 1 or 2 appointments where you're really noticing that benefit. There's a lot of great studies, outcomes now, but it's not a home remedy. So I'm gonna go on to number 8, proper foot hygiene. A lot of the times, thick scarred tissue, calluses, warts, these can cause stiffness, rubbing. Simply trimming these down, softening them up with salicylic acid, creams can make all the difference where your hammer toe, your overlapping toe pain starts to feel a lot better. Check out my guides on that below if you have that thick, hard skin. Number 7, maintain a proper weight. This isn't really a trick. Almost everybody knows this, but the reality is if you weigh like 400 pounds or 300 pounds, this is gonna put more pressure on your feet. And the sad fact is, I think as of 2023, 44% of adults in America and just as much around the world now are obese. Diabetes rates are skyrocketing. That makes your tendons stiffer. That puts more pressure on your feet. And the main thing here is not that you have to lose fat, but that extra weight makes your knees turn in. It makes your feet flatten out. And as your feet flatten out, those tendons now curl. As I mentioned, those flexor tendons can curl and they contract, and that creates that hammer toe, that overlapping toe, that creates that problem. Don't worry, we're gonna show you easy, immediate solutions for this kind of stuff in this video. Number 6, again, not stuff you can do at home, but bone procedures can be done in the office or in the hospital. So if I did imaging like an x-ray or an ultrasound and there was osteoarthritis, that means you have bone spurs, jagged edges, where then you might need to do a procedure. And what I always tell people is take the actual joint and try and move it all the way up and all the way down, all the way up, all the way down, and then compare it to your other foot. Do you have one big toe joint or one hammer toe that won't bend? Is it completely stuck? If it's completely stuck, that might mean that it's more of a bone problem. There's still tricks that you can do. It's not just the soft tissue. It has probably been going on for decades at this point. So the surgeries that can be done are called a PIPJ fusion. So see, this knuckle right here is called your PIPJ joint. So this one right here that I'm bending, that's called your PIPJ. You could put a pin in there. You could put an implant in there. I don't recommend doing that necessarily. There are minimally invasive procedures you can do where essentially making a small poke in the office, you could shave down some of that bone and that toe just settles back into place. The reality is people who have this type of arthritis are usually older. They just want a straight toe. It's not like you're using your toes to pick up marbles or anything like that. You just want them to fit in your shoe so that you can walk, you can jog, you can do everything you need to. I'm a big fan of minimally invasive bone procedures if you do any at all. Now let's talk about soft tissue procedures. If we do an x-ray or if you test at home and all your toes are bending properly, everything's bending, it's soft tissue at this point. That means you can do minimally invasive soft tissue procedures in the office. Take a look at these tendons underneath here. If your toe is clawed like this, see how they're clawed down? If, for example, that tendon loosened, see how they go straight now? Essentially what we can do, just like going to a dentist, we could numb up that area and using a small, simple little tool that's about a needle size, we can go in and loosen that tendon where it stretches. If you ever heard the term trigger finger, basically a steroid injection can straighten your toes. We can do that in the office. That's one of my favorite procedures. It's called a flexor tenotomy or a percutaneous tenotomy. There's a lot of videos of that online. It works extremely well. Now we're not doing this on like little kids. We're doing this on people with severe foot pain, with clawed hammer toes. But these procedures, they're very low risk, very effective, and you can almost start walking right away. These are my favorite procedures to perform in the office. And there's a lot of different procedures. You can do the same thing in the Achilles tendon. You can do the same thing for the plantar fascia to flatten the foot a little bit if you have a very high arch. Padding and taping. I have some great videos about how to tape your toe, especially your second toe, your big toe joint. For things like turf toe, or flexible hammer toes or capsulitis, this can work extremely well. I link some of those videos down below, show you how to do it. You can do it duct tape, you can do it with athletic tape, you could do it with any type of tape at home. This does work very well, but when it gets sweaty, it comes loose and it falls apart. It's not a permanent solution. Number 3, a biomechanical exam. This is actually my favorite solution. But what I do for everybody in the office, I take a look. There's the flexor tendons, there's the extensor tendons, there's so many bones in your foot. And what you're also looking at is your Achilles tendon back here, your calf muscle, your hamstrings, your knees, your thigh muscles, your hips, your lower back. Everybody I look at, you are tighter on one side than the other. Some people are pretty equal. I've even had yoga teachers come see me and they're a little bit off balance and they're very flexible. But essentially, check out your lower back. Your hips, are they equal? Your knees, are they equal? Your calf muscles, your thighs. The muscles in the front right here, they pull on the toes. The muscles in the back, they pull on the toes. We can work on stretching and strengthening those and holding them straighter, just like a dentist holds a crooked tooth until it's straight. That's where good shoes and orthotics come in. Don't worry, they're further up on the list. I'm going to tell you exactly how to do those. But the real key is diagnose any of these underlying issues. Sometimes there's a bad knee, a bad hip, sometimes an injection there can help straighten you out and get you walking better. This just works so well. I'm a big fan of a biomechanical exam, and a podiatrist can help you with that in most cases. Number 2, toe spacers and splints. These just work so well. I mentioned the biomechanical exam. You don't want to rely on just the toe, but if you're a lady trying to wear a nice shoe, if you're a gentleman trying to wear a dress shoe, sometimes these make sense. So they're very low cost, like even the yoga toes that can fit into shoes now. Even barefoot shoes that have enough room for your toes, they make a lot of sense. You can fit more room in there. You can hold those toes straighter. You still want to hold your heel straight. You still want to hold your ankle, your knee, and your hamstring straight. That's why toe spacers and splints, they work extremely well, but they're a temporary solution. They're not a permanent solution. What you really need to do is straighten out your biomechanics in your legs. And the single best way to do that is footwear adjustments. Number one, a lot of people now after COVID working from home, they walk around barefoot. And I love barefoot walking. In fact, I have videos on the topic, all the new research, but a lot of people, they're walking barefoot and they're not getting better. Sometimes people get a lot better walking barefoot, but I would say 75% of people do not. In this case, you want to wear some support until you straighten out. And then when you straighten out, that's when barefoot walking makes sense. Or at the same time, you want to try some sandals and some slippers with some support. So these can be more minimally invasive options, but they have an arch support built into them. So that's going to hold your knee more aligned, your foot more aligned, and that keeps those flexor tendons, those extensor tendons pretty equal. What happens is, if this foot turns out, the tendons are going to pull in that way. But if the foot is straight, then the tendons pull straight down and the toes actually bend up and down. And when I show people this, it blows their mind, but it just makes sense. I'm a big fan of Ortho feet. If you're an older person and you want an orthopedic shoe, I got these for my parents. And hey, I'm a little bit biased. I do work with Ortho feet. I really believe in the company. I put down discount codes and everything for Ortho feet down below. That's a great option, but also Brooks, Asics, On, Saucony. There's so many great supportive shoe brands out there. They just do such a great job. The Brooks Beast, look at this. It has all mesh all around the front. If you're wearing like a leather shoe with stitching along the front, that's a big reason people have big toe joint, bunion, and hammer toe pain. Make sure it's soft mesh where your bunion and your hammer toe does not rub against these things. That right there can make most of your pain go away and help your bunion. Not only will it hold it straighter, but it'll stop it from rubbing. And now the big secret. Check this out. When I hold this straight, see how much that collapses? That forces those tendons to pull in. That makes that toe cross. But in an insole, watch this, when I'm holding it straight, see how it's not collapsing there? Whereas when I take it off, see how that inner arch collapses? That changes the angle of those tendons. So the insole right there, it instantly takes pressure off those hammer toes, off those overlapping toes, off that bunion. And in fact, if you have capsulitis, ball of the foot pain, so if you have pain up here, you could get an insole with a metatarsal pad. I link some of my favorites down below. They are low cost, they work extremely well, and they almost instantly solve these problems. A good shoe plus this insole, it will help you start walking straight. It's like going to the dentist. It holds your tooth a little bit straighter, and that's when you want to work out your hips, your hamstrings, your calf muscles, your thigh muscles. And as you keep walking and as you keep moving, your muscles get used to being held straighter. And the toes, as long as you don't have advanced arthritis, the big toe will straighten out a little bit. The second toe will straighten out a little bit. That third toe will straighten out a little bit. It's not perfect. Like, listen, if you're 70, 80 and you have advanced arthritis, it will feel better almost for sure, but it might not perfectly reduce. At that point, you might want a procedure. If you're young, you're healthy and flexible, if you get your knees, your feet, your hips straight, the majority of the time, you have a really, really good chance of getting these better. And I have seen it in my own patients. It does get better, but at the very least, the majority of the pain quickly disappears. Am I crazy on all this stuff? Tell me if it's not working for you. Tell me if you need a more detailed guide. I got some guides down below. Thank you for watching. I appreciate you guys.